when you look at the side effects of these, memory impairment, like, pretty intense memory impairment, fatigue, weight gain, decreased concentration. So you have people and sleep. It affects your sleep. When you take these, it can delay REM and interfere with your sleep, which leads to fatigue. So what?
So you could get more depressed while on an SSRI.
That is what I'm trying to say.
Okay.
So the concern is that vicious cycle. So you're going through. Let's just say you're like the textbook case in the sense of
you got 5 symptoms for 2 weeks.
Yes. So you're a textbook case. You go on this. You mean you're not getting out of bed. You're not functional essentially. Now you go on an antidepressant. So now other side effects, and let's just say that you're doing therapy. Let's just say you've done some pretty decent dietary things. You've done, some exercise routine. You got your job. You got your finances a little back on your feet. So you're taking the medication. That's potentially we would say helping you.
Right.
But all those other things in your life over time, over those 6-12 months, are coming together. But at the same time, you can't quite get over the hump. Something's wrong because potentially you are dealing with memory impairments, decreased concentration, fatigue, and weight gain,
like a brain fog kind of thing.
Yeah, so and the flatlining. So you're not depressed anymore, but that emotional numbing that is a good thing maybe early on whenever you're at that real low stage is not so good whenever you go to a concert and you can't get real excited for it anymore. It's not real good when like you're not real excited for your kid's birthday party. Those are the things that really I think when you're dealing with an SSRI you should be aware of, and they're very individualized. So again, the vicious cycle that you can see appear is I'm depressed. I've met the criteria. I'm taking the drug. I feel like that's what I need to do.
Right.
I'm trying to get things kind of back on their feet, but the drug is making me depressed. I'm having sexual side effects from it. My libido's gone.
Wow.
So now how are you totally able to get things totally back on track when you're dealing with a powerful medication that is causing a lot of those things? So again, we absolutely do not want to be reductionist about the headline and think that these are always bad, but I really felt to be remiss to not mention some of the things that people are dealing with when they're on these and why they can be so controversial.
Got it. Okay, so it is a complex topic, and
Absolutely.
it deserves professional help and
Yes.
serious consideration on both sides.
Yeah, in pharmacy, and what we see a lot of times is you can tell maybe it's like a GP, a general practitioner, nothing wrong with that. They've been on an SSRI for years. They get 11 refills. They get not even looked at for another year, and they're just on these things perpetually without ever trying to look at other options. So, if you take the headline in that regard and think maybe it's time for me to take a look at this, great. If again, not to rehash all the things we talked about, but if you're taking it too far in situations, maybe for a period of time, or in severe cases, or in some of the other conditions we talked about, if you're taking that headline and running there with it, that's where we have a problem.
Got it. Okay, makes sense.
Yeah, on the clinician end, it's a continual screening process. But if you're the type of patient who you go to your once yearly, you tell them you're good, everything's fine, and you're not examining some of those side effects further, that's what's problematic, because either they could help you come off, or they could switch you to something else that can negate some of the things that Joey mentioned. You know what I mean? It's an ongoing process. And sometimes is it the medication? Is it the condition?
Yeah.
Is my condition, a comorbid condition? Is there something else going on? But if you don't have the cook in the kitchen at all times, then it's hard to parse these things out.
And I could be in a pharmacy too. You get these calls and it's, hey, I saw this headline about antidepressants, and you know what? I'm really tired all the time.
Wow.
I'm on an antidepressant. I've been on it for 4 years. I'm tired all the time. I have trouble concentrating. I'm telling my doctor I'm coming off of my antidepressant, and then it's like, whoa,
Yeah.
So that's again back to like the what can be the harm of these headlines. If it makes people think and process it and talk to their clinician more seriously, I think it's great.
That's the perfect. That's the perfect balance.
But then whenever it's just no, this is my answer. This is why I'm overweight. This is why I'm tired, and this is why I don't get as excited about things anymore. It's not because I'm not exercising and I get up at 11 every morning. It's the antidepressant. I just saw an article about it.
You said it earlier. These things are very nuanced, and if they weren't, we wouldn't be able to sit here talking about it.
Yeah,
we
that's
would
well
have
said.
settled all of this longer. It would be settled science, and that would be the end of that. We wouldn't talk about it anymore. It would just be done.
And also they, clinicians, researchers, they got to just continue to use this to realize that, the research doesn't stop. We got to keep finding better treatments for people that need this kind of stuff.
Absolutely.